Have you ever dreamed of starting your own podcast? Well, you can. It's simple, it's easy, and best of all, it's free. By going to anchor.fm, you can start your own podcast today and have your own show up and ready to go. Anchor's graphic user interface is user-friendly, and you get paid for your content by setting up a Stripe account. Go to anchor.fm. Again, that's anchor.fm, and start your podcast today. Welcome to the Living Healthy Podcast, where you can improve your quality of life by making solid and informed decisions. I'm your host, Eddie Randall. This is part 2 of a 2-part podcast series entitled Women's Health, Applying Knowledge to Optimize Longevity. Now, among the disorders that disproportionately affect women, there are endocrine disorders such as hypothyroidism. Now, the thyroid is an extremely important organ. It's controlled by the pituitary gland and produces thyroid hormones called thyroxine, calcitonin, and triiodothyronine. Now, hyperthyroidism is a disorder that occurs when the thyroid does not produce enough thyroid hormones. The thyroid is essential because the hormones that it secretes help to regulate metabolism and other cellular functions. Women suffer from hyperthyroidism more than men do. On womenshealth.gov, they state that women tend to have thyroid disorders more than their male counterpart. Pregnancy triggers a massive amount of hormonal changes, and women first tend to develop hyperthyroidism during this time. One of the most common hyperthyroidism disorders that women face is Hashimoto's disease. Hashimoto's disease actually causes hypothyroidism. It's an autoimmune disorder that causes the immune system to create antibodies that attack the thyroid. In women, hypothyroidism can cause problems that range from difficulty getting pregnant to irregular menstruation. There's a paper on the Nursing for Women's Health website by Dunn and Turner entitled Hypothyroidism in Women. In this paper, they studied hypothyroidism and the effect that it has on women's health. They go on to state that it's the second most common endocrine disorder in females and that symptoms involve infertility and menstrual abnormalities. And there are many symptoms of hypothyroidism, but some of the most common are constipation, weight gain, fatigue, and becoming easily irritated when it's cold. Treatment for hypothyroidism includes medications and or natural health remedies. One of the more popular medications is levothyroxine. Natural health remedies include implementing a diet that avoids anti-inflammatory foods, also avoiding sugar, processed foods, cauliflower, and soy. Try to also eat meat and eggs, gluten-free foods, whole grains, and fish. Now, moving on to hyperthyroidism. Hyperthyroidism is the antithesis of hypothyroidism, whereas in this condition, the thyroid produces too much thyroid hormone. This condition can speed up the metabolism, and this can cause things such as unintentional weight loss, and this is especially problematic for pregnant women where extra calories are needed to provide nutrition for the baby. Now, hyperthyroidism even causes the heart to beat faster. Women are more at risk for developing this ailment than men, and according to the National Institute of Diabetes and Digestive and Kidney Diseases, women are 2 to 10 times more likely to develop hyperthyroidism. They go on to state that women 6 months into their pregnancy and women 60 and older are the most that are at risk. Now, benign thyroid nodules are very common in this condition. These are non-cancerous nodules that can cause the overproduction of hormones. Aside from tachycardia and weight gain, medicineplus.gov lists other symptoms such as becoming easily upset, getting aggravated when it's hot, weight loss, goiter, and fatigue. Treatment options include medications and or surgery. Sometimes the nodules or part of the thyroid are removed. In severe cases, the entire thyroid is removed, requiring patients to be on medication for the rest of their lives. Now, Graves' disease. Graves' disease is the most common form of hyperthyroidism. And as with hypothyroidism, this disorder results from the immune system attacking the thyroid. The difference here is that the result is producing more hormones. According to the National Organization for Rare Disorders, this disease creates thyroid-stimulating immunoglobulin. They go on to state that these antibodies attach to the thyroid and cause the overproduction of thyroid hormones. Graves' disease stands out from the traditional hyperthyroidism in that it causes exophthalmos and dermopathy. Exophthalmos is inflammation of the eyes. Sometimes people have that bulging eye look where they look like they're scared or they can't believe what they're seeing. That's what exophthalmos is, and it's a telltale sign of this disorder. It can happen in one or both of the eyes, and it can also cause vision problems. So on top of seeing an endocrinologist, I would strongly recommend seeing an ophthalmologist. It's natural to develop vision changes with age, so to have complications from a disease added to that only stresses how much more you have to stay on top of your vision if you have this disorder. Now, dermopathy is the other condition unique to Graves' disease. This is redness and hardening of the skin on the shins. Amenorrhea. Amenorrhea is when a woman misses one or more of her menstrual periods. It's broken down into two types, primary amenorrhea and secondary amenorrhea. Primary amenorrhea is when a girl has not had her first period by the age of 15. The secondary occurs when you've missed 3 periods in a row. Primary amenorrhea can be caused by pituitary gland disorders and genetic abnormalities. The pituitary gland controls the thyroid, which in turn regulates hormones. So any disorder in the pituitary gland can result in amenorrhea. On the U.S. Department of Health and Human Services website, they list genetic ailments such as Turner syndrome or an X chromosome condition and state that they can cause disruption of the menstrual cycle. Secondary amenorrhea can be caused by pregnancy, excessive exercise, stress, weight loss, obesity, low estrogen, and conditions such as polycystic ovarian syndrome. Some medications such as chemotherapy drugs and even birth control pills can cause amenorrhea. The Mayo Clinic lists premature menopause, pituitary tumors, and thyroid disorders as additional causes. As far as birth control pills, they can work both ways regarding amenorrhea. Depending on the contraceptive type and your genetic makeup, oral contraceptives can cause and stop amenorrhea. Speak to your doctor or GYN regarding your particular case. Treatment for amenorrhea depends on if it's primary or secondary. If it's primary, then ovarian hormones may be used. If it's determined that it's a genetic issue, then surgery to remove the ovaries may be necessary as the patient is at a greater risk to develop cancer down the line. However, surgery for this condition is rare, and if it's a secondary amenorrhea, then the fix could be as easy as eliminating or reducing stress. Hormone therapy is also available if necessary, and a simple, cost-effective way to treat this condition is to eat a diet that's high in calcium. Estrogen helps to strengthen bones, and it works by helping the body to absorb calcium. If estrogen levels are low, calcium cannot be absorbed as needed, and in turn, bones can become weak and brittle. This is why so many older women have brittle bones and require bone density tests after they hit menopause. When I took Anatomy and Physiology 1 and 2, I had the same professor, a phenomenal woman. She told us that when it comes to bone health, that when the bones are brittle, that the bone breaks and then the person falls. They can also fall and break a bone, but the majority of the time, the bone breaks first and then the person falls. The next condition is hirsutism. Hirsutism is 5 o'clock shadow in women. Now, this excessive hair growth resembles facial hair growth in men. This can appear in the form of a light mustache, goatee, or just whiskers. Excessive androgen is one common cause, and androgens are male hormones. However, women naturally produce a small amount of these. Another common cause is polycystic ovarian syndrome. Now, there's an article on the American Family Physician website called Hirsutism in Women. It states that PCOS is the primary cause and that it accounts for 3 out of every 4 cases. They also mention that a lot of medications can cause this condition as well. Shaving, plucking, tweezing, and laser treatments are some of the more orthodox methods of dealing with this. The Cleveland Clinic website, they state that oral contraceptives can be used to lower androgen levels and that they can be used in conjunction with medications to specifically treat hirsutism. Mount Sinai's website recommends eating an antioxidant-rich diet to eliminate processed and refined foods in order to naturally treat this condition. Addison's disease. Now, the adrenal glands produce hormones that the body uses for normal functions. Addison's disease occurs when the adrenal glands do not produce enough cortisol and aldosterone. This is an immune system disorder where the immune system attacks the adrenal gland. The hormones involved are very important, as cortisol helps the body deal with stress and injury, and aldosterone helps regulate blood pressure and blood glucose levels. According to the National Institute of Diabetes and Digestive and Kidney Diseases, women are more likely to develop this disorder than men, and the age range that the most women experience this condition is between 30 and 50 years of age. Now, there are 2 types of Addison's disease: primary adrenal insufficiency and secondary adrenal insufficiency. Primary is what I just mentioned, where you don't produce enough cortisol and aldosterone. Secondary adrenal insufficiency is where the pituitary gland does not make enough adrenocorticotropin. Adrenocorticotropin is a polypeptide made up of amino acids, and that is what's responsible for producing the cortisol. HopkinsMedicine.org lists causes of the disease as cancer, fungal infections, tuberculosis, and genetics. Symptoms include back pain, diarrhea, confusion, dehydration, leg pain, low blood pressure, low blood glucose levels, abdominal pain, sexual problems, hair loss, fatigue, and excessive salt cravings. Currently, there's no cure for this disease. The only option is to have hormone therapy replacement for life. As far as diet, low sodium is one of the most common conditions brought on by this disease, and this can result in things like low blood pressure, which can be almost as dangerous as high blood pressure. This happens when the cortisol and aldosterone are not produced or properly produced. This will cause salt to be lost through urination. Before you load up on salty food, discuss this condition with your endocrinologist and or your primary care physician. And if they do not recommend a nutritionist or a dietitian, please ask them to refer you to one. Also, in regard to a diet plan, the NIH.gov website states that if you take steroids to treat adrenal insufficiency, then you may want to increase dietary calcium and vitamin D. They recommend this because the use of corticosteroids are linked to osteoarthritis. Cushing's disease. Now, Cushing's disease is an endocrine disorder that women are 5 times more likely to develop than men. Now, this is according to NORD, the National Organization for Rare Disorders. This would be the opposite of adrenal insufficiency, where the body now makes too much cortisol. This can also develop when too many corticosteroids are taken. Corticosteroids are necessary for transplant patients in order to prevent organ rejection. These medications are also used to fight rheumatoid arthritis and lupus. Even with normal use, there's a possibility of developing Cushing's disease. Genetics can also play a role in this disease, but more often a pituitary tumor or pituitary adenoma can cause the overstimulation of this hormone. Symptoms include a hunchback, round throat, fatigue, diabetes, weight gain, hypertension, stretch marks, slow wound healing, as well as bone loss. Cushing's disease can also cause irregular menses, and women who are pregnant are at an increased risk for miscarriage. Treatment plans include medications that can lower the level of cortisol produced by the adrenal gland or adrenocorticotropin produced by the pituitary gland. As far as diet, it's important to monitor calories as weight gain is a symptom. It's also vital to limit salt intake due to the propensity of high blood pressure. Cortisol blocks calcium absorption, so it can weaken bones, so dietary calcium is strongly recommended. And if you're lactose intolerant, you need to discuss your options with your endocrinologist, PCP, or dietitian. High-risk pregnancy. Now, high-risk pregnancies are pregnancies that threaten the life of the child and or the mother. There are some unfortunate instances where there is drug use, smoking, and alcohol abuse during pregnancy. These actions, unfortunately, promote a high-risk pregnancy. There are also genetic conditions involving the reproductive structures, for example, the uterus. Some women are born with a unicornuate uterus, which is a small uterus. Women with this condition usually have a uterus that is half the size that it should be. This is rare, and women with this condition are more likely to miscarriage. There's an article on Medscape.com by Dr. Paul Lin entitled Reproductive Outcomes in Women with Uterine Anomalies. He essentially reviewed reproductive anomalies in pregnancies. He determined that with this condition, ectopic pregnancies increased by 4%, the miscarriage rate is 34.4%, and preterm birth is short of 40 weeks at 37 weeks at 43.4%, and live birth rates were only 54.2%. Girls under 16 and women over 35 are at a higher risk for having high-risk pregnancies. Other factors include high blood pressure, diabetes, gestational diabetes, asthma, thyroid disorders, extended labor, being underweight, and also being overweight. Now, since the pandemic, COVID-19 can be added to the list of high-risk pregnancy factors. Even though information is still being recorded as cases continue to rise and variants continue to replicate, time will reveal what can be done in order to help lower the risk. The CDC, they state that pregnant women with COVID-19 are more likely to develop respiratory illnesses than women with COVID-19 who are not pregnant. There are things you can do to lower your risk of having a high-risk pregnancy. Some of them are taking prenatal supplements, eating a balanced and nutritious diet, exercising if you can, which will be based on your doctor's recommendation, and staying on top of your blood glucose levels if you're diabetic, as well as visiting your doctor regularly throughout your pregnancy. Breech pregnancy or birth. When a woman feels her baby kick and move around, that's normal. Around the 32nd week of pregnancy, the baby moves his head downward in preparation for birth. A breech pregnancy is a rare situation when the buttocks or feet are where the head should be. The American College of Obstetrics and Gynecology state that breech births only occur for 3 to 4% of births. Factors such as having unicornuate uterus, carrying twins, having abnormal amounts of amniotic fluid, and having the baby preterm or premature can cause a breech condition. A cesarean section is the primary way to mitigate this situation. If the baby does not come out feet first, the cervix may not be stretched out enough, and the baby's head can be trapped in the pelvis, and the umbilical cord can become compressed. A breech baby can be delivered vaginally, but it's very risky. According to birthinjuryhelpcenter.org, compressing the umbilical cord can keep oxygen from the baby, resulting in brain injury and even death. On the AmericanPregnancy.org website, they discuss ways to deal with this situation. Medicine can be given to relax the uterus, and if you like a more natural approach, physical therapy exercises can help move the baby into the proper position. Also, also playing music or soothing sounds attracts the baby, and the baby can move toward the sound. Whichever method or methods you choose, make sure you discuss your course of action with your doctor. C-section versus natural childbirth. Now, the method of birth that you choose will be decided by many factors. The most important is the recommendation from your obstetrician. This recommendation will depend on certain circumstances. For instance, the status of the child, whether it be a breech birth or if the child has birth defects. Although cesarean births take longer, have more risk, and are more complicated, they are safe and can provide the most effective way of delivering a baby. That being said, if there are no complications involved in the pregnancy, I would advise on a vaginal birth. Again, that is based on what the mother wants to do, based on the obstetrician's advice. As I had mentioned when talking about breech pregnancies, C-sections are advisable. Also, if the mother is carrying twins, the mother may want to have a C-section as well. A cool fact that I had found out when I was in college, when I had found about twins in the womb, they actually compete with one another for resources from the mother, and the stronger child takes the majority of the resources. And that was, I just felt like sharing that when I just really thought that was fascinating. And as of 2019, the CDC stated that 31.7% of births in the U.S. were via cesarean. However, sometimes a problem does not arise until the mother is giving birth, which would prompt for a C-section. What's happening is that there is a trend in cesarean sections that are not medically necessary. This could pose a problem and a list of health issues that could arise in the future. Women with multiple C-sections can develop placenta issues like placenta accreta, which can result in getting a hysterectomy. Normally, the placenta breaks away from the uterus after childbirth. With placenta accreta, the placenta remains attached to the uterus and can cause hemorrhaging. This happens when tissue repairs itself from a C-section. And according to the Mayo Clinic, C-section can cause placenta accreta, and this condition can also cause the baby to be born prematurely. Vaginal births are the most common and natural method of childbirth. The typical hospital stay after giving birth vaginally is between 24 to 48 hours. Vaginal births are optimal for the baby as the baby picks up good bacteria from the birth canal as they come out and enter the world. Some comedy shows make light of this moment with the cliche act of the husband fainting after watching his child be born. However, in real life, this is a very important and vital time for the baby. As the baby is born, he's literally bathed in his mother's microbiome. Just as the mother's milk, the colostrum is packed with everything the baby needs. When the mother gives birth, the microbiome, the beneficial bacteria, helps to prepare the baby for life. That's why the mother's health is ever so more important. There is an article on the U.S. National Library of Medicine's website called The Infant Microbiome: Implications for Infant Health and Neurocognitive Development. Now, the article is by Yang, Corwin, Brennan, Jordan, Murphy, and Dunlop. They stated that babies born vaginally have stomach microbiome similar to their mother's vaginal and fecal flora, which gives the baby protection. In contrast to babies born via C-section, they have stomach microbiome similar to the mother's skin and the surrounding areas, which can be a mode for pathogens. What this means is that the mode of birth determines the immunological health of the baby as they grow into a child and then into adult. Both pathways of birth are beneficial, but the method depends on the situation. However, vaginal birth or natural birth is the best option. I wanted to take a moment to say thank you for supporting the podcast. The Living Healthy podcast is listed on many platforms, including Anchor, Amazon Music, iHeartRadio, Google Podcasts, Spotify, Bullhorn, and many others. You can follow me on Twitter, Instagram, and Pinterest. And don't forget to check out the Living Healthy podcast channel on YouTube. Also, if you have any questions or would like me to discuss a particular topic, or you'd like to be a guest on the show, please contact me at livinghealthy@gmail.com. Miscarriage. Now, miscarriage is defined as a baby that dies after 28 weeks. This is a very tragic, emotional, and depressing situation that unfortunately happens. Sadly, miscarriages are common, and according to the March of Dimes, 10 to 15 out of every 100 pregnancies end in miscarriage. Genetics are the primary reason for miscarriages, and there are chromosomal abnormalities that cause this. For example, telomeres are on the end of our chromosomes, and they protect our DNA, and they get shorter each time a cell copies itself. They also get shorter with age. This is just normal function. However, if a baby inherits short telomeres from their parents while chromosomes are forming, this can result in a miscarriage. There's an article on the U.S. National Library of Medicine's website called Analysis of Telomere Length in Couples Experiencing Idiopathic Recurrent Pregnancy Loss. Now, the article was written by Thilagathia, Mishra, Kumar, Vemprala, Dekka, Dwal, and Dada. As the title states, they were comparing telomere length of couples who kept experiencing miscarriages. They determined that short telomere lengths had a direct correlation to miscarriage. The case has been made through studies that the mother's immune system recognizes chromosome abnormalities at some point and prevents the fetus from continuing to develop, thereby initiating a miscarriage. Look at it this way. When a donor receives an organ, despite the blood type matching, the recipient will have to take medications to prevent organ rejection. Even then, the body may recognize and respond to the foreign tissue as a pathogen and begin to fight it. Same thing for a woman who gets pregnant and there are genetic abnormalities in the fetus. This is called alloimmunity, and the immune system can respond to genetic malformation in the fetus. Mellor and Munn wrote a paper called Immunology at the Maternal-Fetal Interface, Lessons for T-Cell Tolerance and Suppression. They state that fetal alloantigens can trigger an immune response from the mother's immune system, resulting in fetal loss. Whatever the case is for the miscarriage, love, support, and care are needed to help the parents recover and get through this time. Ovarian hypofunction. Now, this is when the ovary function decreases, which results in a decrease in hormones. The primary causes are by a chromosome abnormality or an endocrine disorder. Radiation and chemotherapy are also factors that can cause ovarian hypofunction. Women with this condition experience menopause-like symptoms from mood swings, irritability, hot flashes, irregular menstrual cycles, or cessation of menstruation, vaginal dryness, as well as difficulty getting pregnant. Women can get tested for FSH, which is follicle stimulating hormone, as their levels will be abnormal if they have this condition. Treatment for this condition includes hormone replacement therapy involving estrogen, A diet for this condition can include lots of yogurt, milk, and calcium-rich foods. Vitamin K-rich foods like spinach and healthy lean meats rich in omega-3 fatty acids such as salmons. Eggs are also a part of this diet, flax seeds or flaxseed oil. Adenomyosis. Now, adenomyosis is a condition where the endometrial tissue, which is the lining of the uterus, grows into the muscle of the uterus, which is the myometrium. Risk factors for this condition are women that are in their 30s to 50s. It also happens to women who have or have not had children. A C-section, fibroids, and endometriosis are believed to put women more at risk due to the scarring of tissue as it heals after surgery. Symptoms of this disorder include pain during intercourse, heavy menstrual bleeding, bladder pressure, pain when having bowel movements, and bleeding between periods. According to the Cleveland Clinic, doctors are not sure what causes this condition, only that women who have given birth are more prone to developing the illness. Treatment includes medications for pain, and birth control can help, particularly the Depo-Provera shot. The shot can suppress the endometrial tissue from growing. In more extreme cases, a hysterectomy may be necessary. Hyperemesis gravidarum. Now, morning sickness is the nausea and vomiting that women usually experience with pregnancy. In extreme cases, the morning sickness is referred to as hyperemesis gravidarum. This can be brought on by a number of factors such as being underweight, overweight, and becoming pregnant at a young age. At least half of all pregnant women experience some form of morning sickness, but this extreme case, hyperemesis gravidarum, it can lead to women becoming hospitalized as well as being treated with IV fluids. Doctors are able to understand normal morning sickness, but the causes for this extreme condition are not yet fully understood. There's a paper called Hyperemesis gravidarum by Jennings and Kryko. They have a theory on the physiology of this condition. They list hormonal changes, gastrointestinal changes, and genetics as the primary causes. According to AmericanPregnancy.org, they list the differences in morning sickness versus hyperemesis gravidarum. Morning sickness normally has nausea, whereas with this illness, the nausea is constant and takes place along with severe vomiting. The vomiting leads to severe dehydration, whereas the vomiting with normal morning sickness does not. Aside from those symptoms mentioned, other symptoms include skin turgor. This is dehydration to the point where the skin can tent. I remember when I first got into healthcare and I was working at a hospital, I was in training, and one of the patients I had was severely dehydrated. And the nurse that I was with, she had asked the patient if she could show me her arm and explain what she wanted to do. She said okay, and she took the arm of the patient and gently pulled on her skin, the skin on her wrist, and the skin stayed up for like a second. This condition is what will warrant IV fluids in a patient suffering from dehydration, which can be caused from vomiting. Other symptoms can include weight loss, anxiety, depression, fatigue, as well as confusion. The Cleveland Clinic, they state that this condition can be treated by having small meals and medications to prevent nausea. They also state that in severe cases, a nutrient-rich IV may be used and even TPN. I would advise trying to replenish with electrolytes, with a drink supplement, and also getting plenty of rest. Breast cancer. Breast cancer is a terrifying ordeal, and it is all too common. It affects millions of women all around the world. The World Health Organization states that as of 2020, there were 2.3 million cases with 685,000 deaths reported. Aside from genetics, there are chemicals that are used in products that unfortunately contribute to this disease. I went into detail about the risks that women face regarding breast cancer in the third episode of this podcast, entitled Ways to Reduce Your Likelihood of Developing Cancer and Life-Altering Diseases. I had also discussed common causes and ways to reduce your risk, so I won't go into too many details here regarding this, so please check out that podcast. There are other factors that play a role in the propensity for women to develop breast cancer, like alcohol consumption, smoking, not getting enough sleep, diabetes, being underweight, as well as being overweight. The American Cancer Society, they state that women who are overweight tend to have higher insulin levels in their blood, and that the higher insulin levels are linked to breast cancer. Prevention is the best defense. By dieting, exercising, getting adequate rest, and getting mammograms, which I discussed in part 1 of this podcast series, is my recommendation. If you have breast cancer or are recovering, follow your doctor's and or oncologist's advice. On top of that, I advise starting to live healthier through diet and exercise. Also, support is vital, whether it be in a support group or through family and friends. Support, love, and care are very important. Just by knowing that you're not alone is something that can help to bolster recovery. This leads into the next topic of women's health, mastectomies. In society today, there is so much pressure that's put on women to look a certain way. So when faced with a mastectomy, some women may feel that they're less of a woman or feel depressed or self-conscious. The thing to remember that if you need to get this procedure done, that you living and being alive is the most important thing. There's a reason why people age and get old and gray. What everyone looks like is not the most important thing. Who we are as people is the most important thing. Just know, as I mentioned a minute ago, that there are support groups, and if you so desire, there are mastectomy prosthetics. Cervical cancer. All women are at risk for cervical cancer, and the American Cancer Society states that it's estimated that in 2021, there will be over 14,000 new cases and over 4,000 women will die. The cervix connects the vagina to the womb or uterus, and the cervix produces thick mucus to protect the womb. During ovulation, the mucus that is produced thins to allow sperm to enter the womb, and during menstruation, the endometrium in the womb sheds and is eliminated through the cervix and the vagina. Pap smears are vital, as cervical cancer is a slow developing cancer that takes years to develop. Thereby, it is one of the more preventable cancers. Fibromyalgia. Fibromyalgia is a widespread joint and muscle pain. It can alter sleep and overall health. This is pain that is chronic and there is no apparent reason. As an example, your knee is hurting and you don't remember hitting your knee on anything. Currently, doctors are not sure of the cause of this illness. One thing that stands out is that women have it more than men. According to the CDC, they back this up by stating that on average, women suffer from this condition at a higher rate. One thing that may explain this illness is repetitive joint use that eventually gives way to pain. The Mayo Clinic states that repeated nerve stimulation causes a proliferation of chemicals that signal pain. They state that the repetition causes changes in the brain as well as the spinal cord. Pain management is an option to help deal with this condition. I would recommend a diet rich in fruits and vegetables that reduce inflammation. Also, omega-3 is very good for joints. Exercise is always recommended, and in severe cases, physical therapy and a chiropractor may be necessary. Pelvic floor disease. A woman's pelvic floor contains a group of tissues in the pelvis that hold the uterus, bladder, and the bowels. The pelvic floor acts like a sling and this muscle wraps around the urethra, vagina, and anus, protecting them from leakage and prolapse. Pelvic floor disease is any number of disorders that result in urinary incontinence, fecal incontinence, uterine prolapse, or rectal prolapse. The NIH website states that nearly 25% of all women in the U.S. experience some sort of pelvic floor disorder. The risk factors for this disorder include pregnancy as well as giving birth vaginally. Vaginal birth, as I stated earlier, is the most natural way to have a child in comparison to a C-section. However, the pushing involved in vaginal births puts more strain on the pelvic floor. Trauma from a fall or a car accident or sudden jarring sensation can also weaken the pelvic floor. Being obese is also a factor. The same way being overweight takes toll on your knees, the stress from weight puts pressure on the pelvic wall. Having a hysterectomy can also cause this disorder by removing the uterus. It weakens the pelvic floor, and it can also allow the bladder and the bowels to drop down into the vagina. Age can also be a factor, as muscles tend to weaken with age. In addition, this disorder can run in the family. Symptoms include incontinence on its own or incontinence while laughing or sneezing, UTIs, constipation, urinary urgency, urinary frequency, and urinary retention are also additional symptoms. Prevention is indeed the best medicine. Kegel exercises are an effective way to strengthen the pelvic floor. There are articles online to read about them and to get more information. There are also videos online. However, you may want to consult with your GYN or PCP or obstetrician on the proper way to do them. Treatment options include vaginal pessary, where a ring can be inserted to support the bladder. There are also surgical options that include a bladder sling and bladder stimulator. In other instances, medications are used. Interstitial cystitis. Now, this condition involves bladder pain and or pressure as well as pain in the pelvic floor. It occurs predominantly in women. Symptoms of this illness include an urgent need to urinate, pain in the genital area or anus, pain for no apparent reason, as well as painful intercourse. It's also believed that certain foods contribute to this illness. The cause of the illness is yet to be determined, as doctors and scientists are still hypothesizing the pathology. The University of California, San Francisco Department of Urology state that although the cause is not clear, that scientists believe it's due to defects in the bladder tissue, abnormal bladder nerve signals, or it's possibly an autoimmune disorder. Treatments include surgery to remove parts of the bladder, bladder training where you use the restroom at certain times of the day. Medications are also part of the treatment plan. Intravesical treatment, also known as bladder installation, is another treatment option that's used to help heal the inside of the bladder. There's an article by Diziju, I hope I'm saying that right, Taylor, Biddy, and Kular. That was published in July of 2020 by the International Urogynecology Journal. It's entitled "The Role of Bladder Installation in Treatment of Bladder Pain Syndrome. Is intravesical treatment an effective option for patients with bladder pain as well as LUTS?" They state that bladder installations include intravesical lidocaine, hyaluronic acid, dimethyl sulfoxide, heparin, and chondroitin sulfate. Essentially, the use of these medications is to help flush out and heal the inner lining of the bladder. A doctor would insert a catheter and then fill your bladder with the medication and then let it drain. As far as a diet for this condition, I'd advise meeting with a registered dietitian and keeping a physical record of the pain you feel when you eat or drink certain foods. Reason I mention this is because there's no specific diet plan that I know of that can help. Also, every woman is different, and some women can tolerate foods more than others. So recording your intake and pain threshold and meeting with your dietitian is your best bet to help mitigate your condition. Fibroids. Uterine fibroids or leiomyomas are fibrous benign fibrous benign tumors or seed-shaped masses that tend to form in the uterus. Out of all the women that develop them, not all women show symptoms. That being said, womenshealth.gov states that 20 to 80% of women that develop fibroids, they develop them by the age of 50. Symptoms include bladder pain, bladder pressure, back pain, urinary urgency, and urinary frequency. On PrincetonGYN.com, they state that fibroids can alter the shape of the uterus and cause symptoms like pelvic pain, heavy menstrual bleeding, constipation, urinary frequency, as well as urinary retention. As far as having fibroids and being pregnant, due to them being in the uterus, this can be another factor to watch for, as the fibrous masses can cause complications and added risk to the pregnancy. Womenshealth.gov states that women with this condition are more likely to have problems during pregnancy and delivery. They state that the baby may be born premature, there may be issues with labor, breech birth risk rises, and the placenta can break away from the uterus before birth. And the need for a C-section is 6 times greater for a woman that has fibroids. This is another illness where doctors are not clear of the pathology. The Mayo Clinic states that obesity, genetics, hormones, and diet may be factors in this illness. Treatments include over-the-counter medications to relieve pain. Surgical options include myomectomy, where the fibroids are removed, endometrial ablation, where heat is used to manipulate the lining of the uterus, and hysterectomies are also an option. However, that procedure is usually a last resort. Speaking of hysterectomy, this is the removal of the cervix, which is the entrance to the womb, or removal of the upper portion of the uterus, which is the womb. A complete hysterectomy is the removal of both, and this procedure is common in women in their 40s and older. The procedure is done to treat or prevent any cancer or debilitating disease within the female reproductive system. The primary reason is due to fibroids, and the National Women's Health Network states that it's done to treat fibroids, cancer, or any ailment involving the uterus, cervix, or endometrium. They also state that hysterectomies are the second most performed surgical procedure in the United States. The procedure can be done laparoscopically or robotically. There are risks with any and all surgical procedures, but with all surgeries, the benefits must outweigh the risk. And the Mayo Clinic website, they state that blood clots, reaction to anesthesia, nosocomial infections, and damage to surrounding organs are things that women should be aware of. That being said, it's a very common procedure with an extremely high success rate. Multiple sclerosis. Now, this is a neurological disease where the immune system attacks the myelin sheaths that are the protective covers of the nerve fibers. This can result in permanent nerve damage, and depending on the severity, it can cripple the patient. Unfortunately, there is no cure for this illness. It's believed that certain hormones are linked to the condition due to the fact that the illness mostly happens in women. In the Journal of Therapeutic Advances in Neurological Disorders, they have an article by Harbo, Gold, and Tenor called Sex and Gender Issues in Multiple Sclerosis. They state that hormone levels during pregnancy are linked to the direct course of this disease. Now, that's not to say if you have children, you're going to have MS. Lots of women that have MS, they can still manage to have children. And just because you give birth to a child doesn't mean you're going to get MS. It's just that hormones are one of the things that they've linked to the disease. So that's why they're looking at that. Let's see, and also as an example, low levels of vitamin D, they're also associated with women that have MS. Symptoms include numbness and tingling in the fingers, arms, toes, and legs, dizziness, blurry vision, fatigue, and as well as slurred speech. Treatments include injectable as well as oral medications such as corticosteroids, infusions, plasmapheresis, as well as physical therapy. Alzheimer's disease. Now, Alzheimer's is a very sad and debilitating disease. This is where the brain cell connections wither away and die. People affected by this disease have difficulty storing memories as the brain cells continue to die. This condition eventually affects the major organs, causing heart and lung issues, and individuals tend to develop dysphagia. The illness disproportionately affects women, as according to the Alzheimer's Association, there are over 5 million people in the United States with Alzheimer's disease, and 3.2 million of them are women. Treatments for this disease are medications called choline esterase inhibitors, and these drugs work to help prevent the breakdown of nerve cells. I would advise preventative measures, which include exercise and a diet high in omega-3 fatty acid, which can fight against developing Alzheimer's. Also, reading and solving puzzles or even learning a new language. Unfortunately, there's no known cure for this disease. Turner syndrome. Now, this is a genetic ailment that only affects females. Turner syndrome is a monosomy disorder where there is one complete X chromosome and one incomplete X chromosome. This disorder is not inherited but takes place during meiosis. This is a disorder, again, that's exclusive to women. Symptoms of this disease include heart defects, low-set ears, a web-like neck, smaller than average height, delayed puberty, and skeletal issues. Mental health problems are also symptoms. Kidney disorders and hearing problems have also been reported. Reproductive health may be a factor, as this disorder can affect the ovaries. Some women with the disorder may not be able to get pregnant due to the ovaries not developing properly. There's currently no cure for this disease, but according to johnhopkins.org, hormone treatments and estrogen replacement therapy are available for treatment. Lupus. Now, lupus is an autoimmune disorder where the body attacks its own tissues and organs. It causes inflammation and causes damage to the joints, the heart, kidneys, lungs, and the blood. Lupus is another one of those diseases where the cause is unknown. What is known is that more women have it than men. This leads doctors to believe that it's a hormonal or X chromosome related disorder. On lupus.org, they state that lupus is 9 times more common in women than men. There's no cure for lupus. However, with medicine and diet, it can be managed. There are medications that can suppress the immune system and reduce pain. Womenshealth.gov states that treatment consists of medications to reduce organ damage, reduce joint damage, suppress the immune system, as well as reduce pain. As far as diet, I would recommend eating food that lowers inflammation and avoiding sugary and processed foods. I would try to eat foods rich in omega-3 fatty acids and fruits and vegetables that are rich in antioxidants. Scleroderma. Now, this condition is an autoimmune disorder that hardens the skin, and it's a disease that women suffer disproportionately from in relation to men. According to healthywomen.org, women experience this condition 4 times more than men. This disease not only affects the skin, but in severe cases, it can affect connective tissue as well as internal organs. What happens is the autoimmune system begins stimulation and produces scar tissue where there is no injury. Externally, this scar tissue can be annoying, and internally, it can prevent organs from operating properly. Symptoms of the illness include finger and toe sensitivity and coldness, which is classified as Raynaud's disease. Other symptoms include calcified or red patches of skin on the body, dysphagia, overgrowth of blood vessels, muscle pain, joint pain, swelling, and pulmonary hypertension. This disease has no cure, but as with other diseases I've mentioned here, it can be medicinally managed. HealthyWomen.org states that calcium channel blockers can be prescribed to help prevent arteries from sealing shut. Angiotensin-converting enzyme inhibitors, better known as ACE inhibitors, and antiplatelet drugs can prevent cardiovascular disease. They conclude by stating that glucocorticoids and immunosuppressant drugs can also be used. There are diet plans to help alleviate inflammation. I suggest reaching out to your PCP or a dietitian. I also advise eating organic fresh fruits and vegetables, as well as omega-3 rich foods, and avoid processed foods and meat with nitrates and nitrites. Sjogren's syndrome. Sjogren's syndrome is another illness that shows up in women more than men. On Women's Health Research Institute website, they say that women are 9 times more likely to have this disorder than men. And it tends to affect women who are in their 50s and 60s. As with scleroderma, there's no cure for the disease, and it's also an immune disorder. This is literally an irritating illness that can cause your eyes to feel dry and look red. It also causes dry mouth to the point of leading to tooth decay. This illness causes the body to oversecrete, resulting in the dry mouth and dry eyes that I mentioned, eye burning, dry feeling in the nose, vaginal dryness, headache, fatigue, tooth decay, as well as light sensitivity. Treatments include eye drops, medication to reduce pain, medication to increase saliva production, and medicated toothpaste. As far as the diet, the same diet that can be used for the previous condition, scleroderma, I would advocate for having that type of diet. Ehlers-Danlos syndrome. Now, this is a class of diseases grouped as connective tissue disorders. It affects the skin, bones, tissues, and organs. This can account for overly loose and flexible joints known as hypermobility. This can be life-threatening, as the blood vessels and intestines could rupture. The skin is also stretchy and not strong and does not heal properly. Women with this disorder can bleed easily if they're injured or have a cut or a wound. The ailment affects women more than men. There's an article on Orphanet Journal of Rare Diseases. The article is by Rodin, Lebugue, Bescourt, Hamaneg, and Gompel, entitled Gynecological Symptoms and the Influence on Reproductive Life in 386 Women with Hypermobility Type Ehlers-Danlos Syndrome, a cohort study. Now, they state that this disease affects more women than men and causes symptoms in multiple organs. Women with this disorder not only deal with tissue disorders, but they also experience irregular menstrual cycles as well as menorrhagia. This disorder is inherited, and according to the Mayo Clinic, if you have the most basic form of this disorder, there's a 50% chance that you will pass it on to your children. Treatment for the illness mostly consists of limiting physical stress, as skin, blood vessels, and organs can easily rupture. Over-the-counter medications are commonly used to deal with the pain associated with the condition. I would advise mild to moderate exercise and a diet that maintains a healthy weight. Of course, please check with your rheumatologist or PCP about any type of exercise and diet plan in relation to this disorder. Cutaneous flushing. Now, this condition is the redness or blushing that one may experience when they're nervous, angry, or embarrassed. Blood vessels in the face, neck, and chest expand, and the mentioned areas look red or pink. This condition is more of a social concern rather than a medical problem. Causes of this condition range from elevated fever, eating spicy food, rapid increase in temperature, exercising, menopause, thyroid disorders, and rosacea. However, there could be an underlying issue that may be causing this, so a physical exam and blood tests should be conducted if this is a persistent issue. There's an article on the U.S. National Library of Medicine's website called Flushing in Neuroendocrinology by Shmoni, Stratakis, and Koch. They wrote that flushing is associated with increased morbidity and mortality. They go on to list illnesses that can cause flushing, such as carcinoid syndrome, pheochromocytoma, mastocytosis, neuroendocrine tumors, anaphylaxis, medullary thyroid cancer, renal cell carcinoma, Fabry disease, and autonomic dysfunction. Now, the carcinoid syndrome, it's a rare condition where the person has tumors in the intestines. Pheochromocytoma is an adrenal cancer where the cancer causes the adrenal gland to create too many hormones. Mastocytosis is where mast cells grow abnormally and collect under the skin. And neuroendocrine tumors are pretty much the same as carcinoid tumors or carcinoid syndrome. Anaphylaxis is an allergic reaction that anyone can have in relation to a bee sting or medication. And medullary thyroid cancer, this happens when the cells that produce calcitonin turn cancerous, and they can also produce nodules. Renal cell carcinoma, which is kidney cancer, and autonomic dysfunction is nerve damage to the autonomic nervous system. This system operates without our control and handles things such as breathing. So as I mentioned earlier, if the flushing is persistent, you should get it checked out. Osteoarthritis. Now, osteoarthritis is the most common type of arthritis, and it happens when the synovial fluid between the joints diminishes and bone rubs on bone. The condition is painful and can limit movement and has the potential to drastically affect the lifestyle of the person affected. The condition also happens more in women than men, and according to arthritishealth.com, women ages 50 to 60 are 3.5 times more likely to develop osteoarthritis in juxtaposition to men. Pain, swelling, and stiffness are the primary symptoms of this condition. Torn ligaments and torn cartilage are causes, and osteoarthritis unfortunately happens with age. Treatment options are over-the-counter medications, exercise, ice packs, heating pad, prescription medications, and injections. Can also be given in more severe cases. I would advise also having a diet rich in omega-3 in order to limit the amount of inflammation. Osteoporosis. Now, in normal bone health, osteoclasts break down bone and osteoblasts build bone. With osteoporosis, the new bone building does not keep up with the old bone being broken down. Symptoms include back pain, a stooped posture, and gradual loss of height. Risk factors are age, hormone imbalance, heredity, and the size of your body. The Mayo Clinic lists some factors as being female, age, genetics, hormone imbalance, and having a small body frame, as people with a smaller frame have less bone to draw on as they age. Treatments include prescription medications to address the condition that has caused the ailment, and this includes pain medications as well as hormone therapy. As with osteoarthritis, I would recommend a diet that's high in omega-3 fatty acids, vitamin D rich foods or supplement, calcium rich foods or supplement, as well as exercise. Varicose veins. Now, this condition happens when the valves of the veins located in the legs become damaged. When blood pressure increases in the veins, this leads to the damage, and the veins are visible on the upper layer of the skin. I'll also mention spider veins here, but the difference is that they're smaller than varicose veins and they look like a spider web. Varicose veins could lead to a more serious condition such as deep vein thrombosis. Visually, this condition can seem more like a superficial issue, and unfortunately, some women may feel embarrassed or ashamed to have varicose veins. If this condition happens to you, you should not feel embarrassed or ashamed. The risk factors associated with varicose veins are being a female, becoming pregnant, being overweight, age, injury to the leg, and lack of mobility. There are injections and surgeries to help deal with varicose veins. Women'sHealth.gov lists sclerotherapy as being the most common treatment, where doctors inject chemicals into the vein to allow them to seal shut, and in the coming weeks, the vein will fade. They go on to list surgical procedures like ambulatory phlebectomy and surgical ligation, where the veins are removed. New veins will grow back and take their place. Prevention for this condition is simpler than one may imagine. You can do things like wearing compression stockings, exercising, being more active, elevating your legs, and avoiding being sedentary. Well, this will conclude the podcast series on women's health, applying knowledge to optimize longevity. I appreciate your support with the podcast, and I want to thank you all for listening. I'm trying to reach more listeners and get the podcast on more platforms as we speak. As always, I'm looking forward to the next episode. Thanks again for listening. And remember, living healthy creates a better you.